different topics on health and well-being. And today we are so grateful. We have in our association AmiyaPrema Radha Dasi, also known as Amy Anand, and she's been a pharmacist for the last 13 years, having worked across so many sectors, including community pharmacy, industry, and general practice. She's currently working as an independent prescriber, a pharmacist for GP practice, and as an educational trainer for foundation pharmacists. And so we invited her today to please come and share with us all her wonderful knowledge about medication management, which we all know is a devotional duty. And so we're looking forward to hearing from her about what is our duty as a devotee as far as medication management is concerned. So I hand over to Amiya, and we look forward to your topic. Thank you.
Thank you so much. So thank you so much, Sukanti Ranamataji, for the kind introduction. And thank you to yourself and to this platform for allowing me to come today and speak a little bit about medication management and pharmacy in general. Thank you to all for joining as well. Hopefully today I can say something that you find useful, and maybe there might be one or two points that you can pick out to practically implement in your kind of daily lives. So thank you all. So when I was approached by Sukanti Mataji, I was just reflecting on what is it that I could say about medication management? Is it just about popping a pill, or is there more to it? And when we're trying to practice spiritual life, how can we tie in the two nicely? So we're trying to practice spiritual life to the best of our ability, but also taking care of our health, which we could see as our material body. So I just wanted to start off with just telling you a little bit about my journey. Now, what we generally find is that people don't actually have much knowledge about pharmacists, what they do, how much training they actually undergo to get to the place they are, and how they can actually help their patients. So just to give you a little bit of an idea, I thought I'd briefly tell you about my journey. So a pharmacist undergoes extensive training. So I'm originally from Zimbabwe. I did my A-levels, I did my studies till A-levels in Zimbabwe. Then I did my master's in pharmacy at Aston University. So this is a 5-year degree. So all pharmacists in the UK, other parts might be a little bit different. We go through a 5-year degree. That includes a 1-year training year. So kind of a 1-year placement year where you're working full-time alongside studying. I then completed a 2-year diploma, and this was more as a 2-year clinical practice diploma, so going into the clinical side of medication and your health, and then did a independent prescribing qualification that allows me now, and a lot of pharmacists are going on this route where they can prescribe medication just like a GP would. I guess the only restriction to that is you would prescribe in your competence. So only what you feel you're competent to prescribe. So that was 6 months on top of your other 5-year degree. And because I'm working in GP practice as well, I've also completed a primary care pharmacy education pathway, which is an 18-month course. So, I mean, just to give you a little bit of a brief idea that actually there's extensive studying that a pharmacist has to go through to get to the place where they are. So just make sure everyone is muted. So yes, if you're joining, please, if you can mute your mic so there's no background noise. We will have an opportunity for questions in between and at the end. So happy to take on questions as we go through this talk as well. Yeah, so pharmacists are your expert person to go to when it comes to medication. Doctors are when it comes to diagnosis, but when it comes to medication, we find even in general practice where I'm currently working now, I'm working as a prescribing pharmacist in general practice. So this is in your doctor's surgery. The doctors are always messaging me to ask, so this patient is on these medications, what's the most suitable? Can you check if there's any interactions? they've got these allergies or they've got these specific requirements. Can you check if there's specific medications that they can't and can take? So when it comes to medication management, the pharmacist, your local pharmacist is an expert. So following my education, I then went on to, I worked in community pharmacy. This is like your local friendly pharmacy around the corner where you get your prescriptions from. I worked there for 10 years. I then was the foundation pharmacist training lead. So basically working in education. Like I said, pharmacists, after they've completed their 4-year degree, they have 1-year placement year. In that year, they are studying for their exam, which will eventually allow them to register as a pharmacist. And they're also working full time. So I kind of developed the training package for Well Pharmacy for that. And I currently work as a casual tutor and portfolio mentor for Keele University, as well as my main role being in GP practice. Okay, so I just wanted to cover that just briefly, just to give you guys an idea of where pharmacists can work and the amount of training that they have to go through to become a pharmacist. Okay, so yeah. So just kind of following on from that, where do you find your pharmacist? I'm sure everybody knows their local pharmacist or has come across a pharmacist at some point in their life. So community pharmacy, this is very much UK based because I'm in the UK. I appreciate that in other parts of the world, you'll probably still have very similar ways your pharmacists are working, but your pharmacies will probably be called something different. But I've given examples here. Boots Pharmacy is the largest pharmacy chain in the UK, followed by Well Pharmacy, and there's several different small independent pharmacies. Then we've got pharmacists in the hospital pharmacy that take care of your medications, take care of your discharge medications, and give you all your medicines that are prescribed by the consultants. General practice. So now most doctor surgeries, if you inquire, will have a clinical pharmacist working as part of the practice. So a really good resource. If you can't get an appointment with your doctor, then your pharmacist is a good person to go to, because 9 times out of the 10, they can help you with medication queries. Then we've got pharmacists working in the clinical commissioning groups. So this is where they look at the different medications, if they're the most cost-effective medications, and medications that are going through clinical trials, etc. And of course, there's education and teaching roles. Okay, so that's just briefly a little bit about pharmacists. What I'm going to cover today, I'm going to try and look at how we can tie in medication management with spirituality, and kind of discuss a few common questions, misconceptions when it comes to taking medication on special days like Ekadashi. What do we do if we're vegetarian, vegan, and need to take medications? So I'll try and briefly cover those points as well. Okay. So I'm happy to take questions as I'm going through. So please, if you want to, you can pop them in the chat. However, I am going to leave a nice amount of time for anyone to ask any questions. So please feel free to, once we're at the end of this talk, to save your questions till the end as well. So I'd just like to start off with Srila Prabhupada, the founder Acharya of our ISKCON movement. Did you all know he was a pharmacist by material profession? I'd like to see some hands or some thumbs up, or put it in the chat. Were you all aware of this, that Srila Prabhupada was a pharmacist himself? So what a lovely coincidence. Okay, so I've got a no in the chat. So thank you, Bharati, for telling us. Yeah, Sekanti Mataji knows. Anybody else? Were you guys aware that Ankit knows that so Srila Prabhupada himself, so the founder of Acharya of our ISKCON movement, was actually a pharmacist himself. He owned and operated Prayag Pharmacy in Allahabad, and he was actually practicing as a pharmacist when he met his spiritual master. So I thought that was a really nice point to kind of bring to everyone's attention initially. So he practiced, he dispensed, and he had a pharmacy business of himself. When I'm going through the next few slides, I just wanted to focus on 2 points, 2 key meditations that I wanted to kind of look at this talk in relation to. The first one is a quote from Chaitanya Charitamrita, Madhya Lila, chapter 22, verse 113. And basically the translation says that Krishna is the origin of Lord Vishnu. He should always be remembered and never be forgotten at any time. All rules and prohibitions mentioned in the Shastras should be the servant of these two principles. Okay, so this verse is a quotation from the Padma Purana. And it tells us that there are actually many regulative principles in the Shastras and directions given by different spiritual masters. These regulative principles should actually act as a servant to the one basic principle, which is to always remember Krishna and never forget him. Okay, the purport goes on for more to say that this is possible when one chants the Hare Krishna mantra or the holy names of the Lord. The second aspect I wanted us to meditate on while going through these slides is that Srila Prabhupada had a sign in the kitchen that said, health is number 1, chanting is number 2, service is number 3, and then comes reading, in that order. This was a handwritten sign by Srila Prabhupada. If you look at Prabhupada's memories, there's a little saying by Kusa who says, I was only able to cook for Srila Prabhupada for 3 days because of a health issue. So Srila Prabhupada had a handwritten sign in the kitchen. So essentially what we get from this is that it is absolutely essential to take care of our health. Health is number 1. Without our health, we can't do our sadhana, we can't do our service, and we can't do any reading. I mean, I'm sure you guys have always had, most of you might have had this experience where you are extremely ill, whether that's kind of a chronic condition or whether you are just down with the flu or kind of a virus and infection, and you might be able to relate of how ill you actually feel. Like you want to pick up your beads, but you can't pick up your beads to chant. You've got a number of services lined up, but you can't do that. So all of that means nothing if we don't have our health. So Prabhupada made the point that in what order of importance we need to take our life seriously. So I wanted us to focus on these two meditations, essentially because we find as pharmacists that not only in the devotee community or in the spiritual community, but in patients in general, compliance of medication is a real issue. Patients don't take the medication. They sometimes think we don't need our medication, or they don't take the medication as directed. So if you don't take your medication as directed, you can't expect that medication to have the effect it should have. So we always find that is the case. And in our devotee community or people who are practicing spiritual life, it goes one step further where they feel that actually, I don't need to take any medication. We have this misconception that actually Krishna will take care of us. I don't need to take any medication. Now, yes, maybe if you are Paramahamsa stage or if you are completely detached from your body, Krishna is taking care of us. But what I'd like to say is that actually Krishna is giving us the facility to take care of ourselves. So if we don't actually take care of ourselves, then we are doing our injustice to our service and our sadhana. So when I'm going through the next couple of slides, I wanted to focus on these 2 points. And I think I'll always be coming back to these 2 points, that all rules and prohibitions mentioned in the Shastras should be the servant of these 2 principles, that always remember Krishna and never forget him. And then this quote, that health is number 1, followed by the other things that we want to do. Okay. So I've also got a few quotes, and I've just popped them there on the screen haphazardly. So Srila Prabhupada gave varied instructions about health according to time, place, and circumstance. We always see that Prabhupada wasn't neglectful of his own health or the health of his disciples. In fact, Srila Prabhupada always concluded his letters. So if you look at the letters that he writes to his disciples, he always concludes his letters with, I hope this meets you in good health. So the underlying principle of Prabhupada's instruction regarding health was do the needful for keeping the body, soul together in order to serve Krishna. And if irreversible conditions do arise, then one should carry on serving Krishna to the best of one's capacity, always depending on his causeless mercy. Okay. So again, important to take medication if it is prescribed to you. for a certain reason. Now, I'm just going to read out the few quotes that are on the screen, just to kind of bring this to life a little bit more. So Srila Prabhupada wrote in a letter, June 19th, 1975, "It is important to keep the body fit and healthy so that we will not meet the obstacle of ill health while serving Krishna. Ill health might hinder one's service, so we want to avoid it as much as possible. Regarding your physical malady, you should do whatever is required to treat it properly, whatever is most practical. One of the symptoms of a devotee is that he is kind. So if our god brother becomes ill, it is our duty to help him to get the proper medicine and treatment so that he can recover." So this also shows that being part of compassion is actually to take care of the community around us and encourage them to seek proper treatment and take their medication as they are directed to. So that is actually part of our duty as well. If we see someone ill in our congregation or devotees around us, then we should encourage them to see their doctor, see their pharmacy, get the medication that they need, whether that is antibiotics or anything, for them to treat themselves. Keep your health in good condition and work very hard for Krishna. That is our motto of life. So I just want to just ask the question. Please feel free to type in the chat. How many of you feel that they know a few people or many people where they don't take their medication, or they're a little bit reluctant or negligent about their health? So they neglect their health and they neglect taking medication, maybe with a bit of an attitude of Krishna will take care of me, or just generally just a little bit irresponsible in that way. So I guess a bit of an open question. And I want you guys to just pop it in the chat. So only I can see the chat. Well, all of us can see the chat, but I'll just keep the answers quite anonymous. So I just want to kind of hear from you guys. Do you feel that is the general case around you in terms of medication? If you look at your personal lives as well, do you tend to take medication? What is your view around medication and taking it for our health? I'm just going to give you a few minutes to pop it in the chat, what your guys' thoughts are in terms of medication. If there are any pharmacists, I'd love to see what they think as well. If they've had any interactions where they find that patients don't take medication. Like I said, as a pharmacist, I see the number one problem is medication compliance. Patients just do not want to take the medication. They're very neglectful. They say that if it's a devotee, that Krishna will take care of us. So thank you. I've got a few comments coming in the chat. I've heard this a lot of times where a few devotees say that Krishna will look after me and I don't want medicine. I've got a few people saying that they are actually guilty of this themselves. Many don't know. I've got a few coming on. Many people that this person knows doesn't like to take medications despite knowing the repercussions. I've got a comment here. It's hard to remember to take medication. So I think I might touch on that a little bit as well. Just some really practical tips of how to take your medication. I've got a comment here that avoid taking medication on Ekadashi day. This is a very interesting comment, and I'm going to kind of address this in the next slide. So thank you for that as well. Got a dentist on the call as well. And they've said that as a dentist, I see few patients don't take medicines regularly due to lack of understanding why they need the certain medications. So important. Thank you all for sharing, and thank you for popping this in the chat. Yeah, so I guess as a pharmacist, I've got another comment. I avoid all medication when fasting. Okay, fantastic. Thank you for sharing. Yeah, so I think another role of your pharmacist is they can actually explain to you why your medication is being prescribed. Sometimes you find that you go with something and you just get a medication haphazardly without much information. So I guess what I'd like to say is use your pharmacist as a resource, that they have a wealth of knowledge in terms of medication, its uses. If you have any doubts or concerns of what it's going to do to you, please speak to your pharmacist. And I've got people who have become complacent long term. Thank you so much. Okay, thank you for sharing. I think we're all very much on the same page. So I did want to touch on a few different topics which I thought might be quite interesting. So somebody mentioned in the chat Ekadashi. So I also want to touch on Ekadashi. So should we or should we not take medicine on Ekadashi? The first thing I'd like to say, this is a personal choice. Okay. I can't tell you to take medication Ekadashi or not to take it. It is a very personal choice, but we need to use our intelligence. So I want to go back to the first two principles and key meditations that I had mentioned when we started, which were always remember Krishna and never forget him. And first comes your health, then comes your sadhana, and then comes your service. Now, why do we fast on Ekadashi? What is the prime reason? According to my understanding, is to reduce our sense gratification, to be able to focus less on the senses and focus more on spiritual topics, reading. So we kind of minimize our material tendencies of eating, etc. And we focus on reading and developing our spiritual sadhana, more reading, chanting. So that is the essence of Ekadashi. So I guess the first question I'd like to ask is, does taking a medication mean you are gratifying our senses? I'm just going to put it as an open question and leave it there. What I do want to say that there are some medications that can be taken on a when required basis and which won't do any harm if you miss them. These are, for example, multivitamins. Yeah, it's fine. If it's just a supplement, an iron supplement, a vitamin D supplement, just a multivitamin supplement, that's completely okay. Heartburn and indigestion remedies sometimes maybe, okay, fair enough, I can miss it on Ekadashi. However, there are some medications that really shouldn't be missed, and missing them can have a very detrimental effect on our health and cause further issues in the long run. In turn, again, affecting our sadhana and our service. Just to name a few, if you're, for example, diabetic, type 1 diabetes, if you're taking insulin, it's absolutely essential for you to have your insulin. Type 1 diabetics cannot survive without insulin, okay? Some patients who are on heart medication, if you're on antibiotics, it's absolutely essential you complete the antibiotic course. Antibiotic resistance is so big. If we don't take antibiotics as prescribed, what we'll find is that a couple of years down the line, there won't be any antibiotics that will be effective for infections. Okay. So I've just got something coming with it. Yeah, blood pressure, thyroid. So blood pressure is an interesting one. We find a lot of our patients, if their blood pressure is well controlled, if it's literally just hypertension and a blood pressure medication, they might just choose to miss that one day. That might not cause so much of a big impact if it's just one day. But what I would say is that we need to use our intelligence. If some patients, if you are steroid dependent, for example, if you're on long-term steroids and your body is steroid dependent, you need to take your steroids. If you don't take your steroids, your body will go through a adrenal crisis. So really important. So I would say we need to use our intelligence, see what you can and what you can't take. Essentially, remember that the idea of Ekadashi is to limit our sense gratification, and Ekadashi can be done at different levels according to our capacity, starting from Nirjala, where there's no water, and then working upwards. When we have a question and answer session, I'm happy maybe to go a little bit more in depth about any personal type of questions. But I would say that there are some medications that should not be missed. So really, we need to use our intelligence and then take medication or not take medication accordingly. Just don't be neglectful without thinking of long-term consequences and thinking about it with intelligence. Krishna has given us intelligence for a reason. So there's a nice quote here from the Nectar of Devotion or Bhakti Rasamrita Sindhu, which says, when one is not attached to anything, but at the same time accepts everything in relation to Krishna, one is rightly situated above possessiveness. On the other hand, one who rejects everything without knowledge of its relationship to Krishna is not complete in his renunciation. So I'd like everyone to just reflect on this point. This topic was called every dose is a devotion. Sorry, that's just gone back. every dose is a devotion, and every pill I've forgotten the topic myself now, but I'm going to get it back up so I can have a quick look at what it said on the poster. So every dose, a devotion, every pill, a prayer. Okay. So really, if you think of taking medication, you can offer your medication to the Lord. If you think of it in that way, then that will help you make decisions in terms of whether you should or should not be taking medication on Ekadashi. Okay. So I hope that's okay. I've left it a little bit open. Okay. So I've got a slightly different view come in, so I'm happy to read that out. This person is saying that they feel doctors often push or give medication rather than offer support to investigate the root cause. Modern medication and pharmacology is very focused on pumping as full of chemicals. So this person personally prefers a herbal approach. Okay, and that is, I completely understand that and agree with that to some extent. So it'd be interesting for us to discuss this a little bit later. I have got a little bit of a slide on the difference between allopathy and Ayurveda homeopathy. So I think we'll touch on this a little bit more when we come to that slide. But thank you for sharing that. Okay, fantastic. So hopefully that's okay when we talk about medication on Ekadashi. Another real key question that we get asked is about being vegetarian or vegan and taking medication. So this is a real good source. Usually this little table tells us that the common animal-derived excipients in medication. So we usually find one of the key things is gelatin, which obviously we know comes from the skin and bone of cattle and pigs. Usually we find that the capsule, a lot of the time, is a gelatin-based capsule. Sometimes modified release tablet preparations can also contain it. So this slide kind of shows you the different types of things we can find in our medication. Okay, so the active medicine ingredient usually in a lot of medications is a very, very small proportion of the contents of the final product formulation. Okay, so we have what we call excipients. Now these are used to manufacture the medication. So if you think of a paracetamol tablet, like the paracetamol actual active ingredient is very, very small. It's about 5% of your tablet. So the other 95% of the paracetamol is actually just excipients like lactose and different things, starch, to make up the tablet so it's in a acceptable size for us to take. And the excipients also allow the actual active ingredient to stay okay in different kind of environmental conditions, etc. So usually what we find is that it's the different excipients which become a bother for us when we're trying to practice a vegetarian or vegan diet. Okay. So some of these excipients can act as antioxidants, emulsifying agents, colorants, etc. Okay. Now, how do we know if our medication is vegetarian or vegan? Firstly, all medications have what we call a summary of product characteristics or a patient information leaflet, which usually tells you if this is suitable for vegetarians, and it will tell you whether you can take it or not. What I would say is that you need to ask your pharmacist for alternatives. Being a vegetarian or vegan means if you tell your GP when you're having medication that I'm actually vegetarian, they have to. This is actually something they have to do. They have to go away and find alternatives for you. They have to try their best to find different alternatives for you. So I've got a few things that we can do on this slide. And like I'd mentioned, that most GP practices do have a pharmacist who are an expert on medication. So it might be that you need to speak to them. So if there is a medication suitable for your healthcare and vegan needs, you can request this, and it should be prescribed if there's no reasonable grounds for you to refusing to do so. Okay. So usually grounds for a refusal would only be if it's unavailable or inaccessible, or if the medication that is vegan or vegetarian is unreasonably very, very expensive. Okay. Some capsules that contain gelatin, they can actually be popped open, and the ingredients inside can be dissolved in a little bit of water, and you can take that as well. Okay. Some manufacturers use pre-gelatinized starch as a vegan-friendly alternative to gelatin capsules. There are tablets which contain sucrose as an alternative to lactose if you're vegan. And usually liquids or dissolvable sachets or tablets are usually vegan-friendly. Again, so this is a very general way of looking at vegetarian vegan medication. I guess the underlying factor here is, underlying point that I'd want to say is, please speak to your pharmacist. They can help you with your medication choice. They can tell you whether your medication is suitable for vegetarian vegan. If you do everything possible and then you find out that actually there is very little that's out there and the medication I specifically need is maybe not vegetarian, then I'd go back to that point of using your intelligence and seeing, kind of weighing out options again in terms of your health and medication, what you should be doing. Okay, so really important to please speak to your pharmacist. I think I'm seeing more and more as a practicing pharmacist that actually there are a lot of vegan and vegetarian options out there, because not just the devotee community, but just there are a lot of activists out there who are very much promoting veganism, and they are very strict on this. So I think the pharma companies are seeing that this is the trend, and there is a lot of alternatives that are available. Okay. Okay. So just got a couple more slides. I am hoping to finish kind of in the next couple of minutes, so then we can open up for a few questions. So I wanted to put a slide on here that actually we've talked about medication management, and my take is that you should be taking your medication. Okay, if it's prescribed, it's there for a reason, and you should be taking it. However, I do want to touch on one thing, that actually prevention is better than cure. So if you can keep your health in good condition and work very hard for Krishna, that is our motto of life. This is what Srila Prabhupada says. So it is essential that we maintain our health through proper diet, exercise, sleep, and cleanliness. Okay. And I've put this quote: "Don't live to eat, but eat to live." This is obviously, you can see a little bit of a joke, but it's essential. Like in the devotee community, we find sometimes, and I'm not generalizing, but I do tend to find that prasadam is amazing. But even prasadam, everything should be in moderation. Sometimes I see people saying that it's prasadam, so it's fine. We can just kind of eat and eat and eat and eat and eat because it's sanctified food. Yes, I agree, but even prasadam should be had to a limit, and then when you feel full, you should be stopping. So sometimes that is a fault of us in general, where we think that things are okay to just kind of do because we say it's spiritualized. Yes, but remember, we need to take care of this body, and there's only so much we can eat. So I've only focused on one part of this, which was diet, but same with exercise, same with sleep, same with cleanliness. It is really essential. So what I'd say, medication is there because there is a need for it. In terms of your health. However, if we can even prevent getting to that point, then prevention is better than cure. Okay. And this is a little bit that is from a letter from Srila Prabhupada, 23rd of August 1968, where he says that, yes, the point is that we should not eat more than required. Eating, sleeping, mating, all these are material demands. The more we minimize, then it is good, and not at the risk of our health. Because we have to work for Krishna, so we must maintain our health very nicely. We should not eat more than is required for maintaining the body and the soul together. That is the principle. Okay. So, right. So we had a comment in the chat about a person's view in terms of doctors pushing medication rather than offering support to investigate the root cause. And this person looked at felt that a herbal approach was more better. So I just wanted to touch on this. I would like to say that I'm not an expert in Ayurveda, homeopathy, so I cannot really comment on that. However, from my little knowledge, I know allopathy, which is the modern Western medication, this relies on treating specific symptoms, whereas homeopathy and Ayurveda emphasizes holistic healing and the use of highly diluted natural substances. This Prabhupada did say that the 3 things that kept him healthy were his morning walk, his massage, and Ayurvedic medicine. So Prabhupada did tend to take Ayurvedic medications. When I was doing a little bit of research, I did see that he did actually take some blood pressure medications and diuretics as well. So when it comes to modern medication, what I'd like to say is that actually medication goes through vigorous testing and clinical trials. In the UK, we've got the MHRA, which is the Medicines, Health and Regulatory Authority. And in the USA, we've got the FDA, the Food and Drug Association. So these are governing bodies that ensure that medications go through intensive clinical trials, and they have to be convinced that this medication is safe and okay to take before it comes out into the general population. So I'd like to say in one way that we can have a little bit of comfort knowing that these medications we're taking have gone through lots of clinical trials. And if you are prescribed for a medication, it's for a reason. So what I'd say, compliance is crucial. I am all for Ayurveda and homeopathy, but what I do say, again, it comes to compliance, following through, and doing the needful for your health. I'll just give you an example of a patient recently. They were prescribed that they've got heart failure, and they were prescribed diuretics, which are basically medications that help to remove excess water from your body. So they were already on 3 of these diuretics, and they were prescribed an additional 4th one. In their mind, they were like, oh, we don't need, what's the point of this? I'm already taking so many different medications. So they didn't take this. They didn't take this prescribed medication for 1 full year. And they had several really big, painful water fluid-filled blisters on their legs, on their feet. And you can imagine how painful they would have been. But just, I don't know, it was out of pure stubbornness or just saying, no, I'm not going to take medication. They didn't take it. When they did start taking it, they found that within a couple of weeks, all those fluid-filled blisters had disappeared. And they understood then the importance of taking that medication. I do agree, sometimes doctors are just pushing medication on you, maybe because time is scarce, so they can't spend enough time with you to go through your health, and they feel that the medication will just kind of sort out everything. So again, I always come to using your intelligence. Do what you need to for your health. When you are prescribed medication, if it is for a genuine reason and it is helping you maintain your health, then you must take it because it will help you perform your sadhana and your service accordingly. Okay. If you want to go down the Ayurveda route, then yes, all for that as well. Again, I would say seek advice from an expert, and again, follow the prescribed way of taking it. If you do not take medication as it is prescribed, you cannot expect the results as you are told that you will get. I just wanted to kind of that. So we're coming to quarter 9, so I just wanted to just summarize, and then I will open it up for any questions or any comments really that anybody might want to have. A lot of this are my views as well, sharing it as a pharmacist and what I see happening in practice, but trying to bring up Shastra and scripture to help you, just aid you in making any decisions that you are looking at making. So there's nothing right, there's nothing really wrong, but you need to take ownership of your health to ensure that you are doing what you need to ultimately serve Krishna nicely. Okay, so just a quick summary really. Medication is there for a purpose. Just like you go in a drug shop, it is not that something is medicine and something is nonsense. Everything is medicine, but the doctor sees the particular patient and he fixes up the medicine. This is for you. So for example, if you are suffering from constipation and you are prescribed medication for diarrhea, obviously it's not going to have the desired beneficial effect. So yeah, Srila Prabhupada very nicely puts, it's not that one is a medicine and something is nonsense. Everything is a medicine. However, the doctor sees the particular patient and it gives you the medicine accordingly. So some very practical points. I did see that a few patients put that they just forget to take it. So the first thing I would say is take your medication as directed. All medication will come with a label which tells you how to take your medication. So take the medication as directed. There are now a lot of different apps. You can use a pill box. A pill box allows you to kind of pop your medication in different times of the day, morning, afternoon, lunch, evening, and you just need to, you can set that up once a week, maybe on a Sunday, ready for the week. So try and do that to help yourself. It takes away the stress of having to remember, especially if you're on more than 2 or 3 medications. There's a lot of use your phone. All of us tend to be stuck to our phones anyways. So use it to help you in terms of putting some alarms, some reminders to help you take your medication as well. Keep your medication organized. So if you've got several different medications, maybe have a tracker that you use, or have a specific compartment where you keep your medication. Like I said, use a pill dispenser. There's so many things you can do to keep your medication organized. Take your medication as directed again. So if you're taking medication and you're not noticing any symptoms, a lot of patients come to me and say, oh, I'm on blood pressure medication, but my blood pressure is now controlled. So can I stop my medication? Usually my response is your blood pressure is controlled because of your medication. So please continue taking it. If your blood pressure goes down to an unacceptable level, then we can consider stopping. So please take it even if you don't have noticeable symptoms, or even if your symptoms get better. Okay. I would also say that, again, I come back to the fact that your pharmacist is your person to go to in terms of medication management. Please just use this resource more. In the UK, especially, maybe in other parts of the country, there is a pharmacist in most GP practices now. I see a lot of patients coming to me asking for specific vegan formulations, or to check if they're taking all these herbal products and if the medication is okay with it. So please use your pharmacist to find out if you want to ask about specific questions about your medication. Okay. And just a final slide I wanted to end on, which was the topic of today, medication management, a devotional duty. So I really want to stress that our medication, our health, our body is a sacred offering to the Supreme. So every dose is a devotion, every pill a prayer. This is very nicely kind of worded by Sukanti Radha Mataji. So I'm very grateful for that, because she's really worded this very nicely. And I want to end on a little bit of a story, or just an example, really. If we see in the Ramayana, when the battle is going on between Ram, Lakshman, and Ravana, Lakshman is injured on the battlefield, and he is kind of on his deathbed. And that's where Hanumanji is asked to go and get the Sanjeevani booty from the mountain. So Hanumanji then goes and gets that, and then that is used to treat Lakshman. So we're just human beings with material bodies. So if the Lord himself, so we obviously know that Lord Ram and Lakshman came down and they took these forms for a reason. But if the Lord themselves in these material bodies needed medication, then who are we? So I would like to end on those 2 meditations again, that always remember Krishna and never forget him. And everything should be done in relation to that. So we shouldn't be neglectful. Even when taking medication, we can do it as an offering to the Lord. And then the second point, that health is first, our sadhana is second, our service is third, and then comes reading. So if we can take care of our life in that order, we will see that we will be able to kind of really proceed and really do well spiritually as well. So thank you for listening. I am just going to stop the recording for now, and then we'll open up to questions if there are any questions.